Testing 1, 2. We're not going to be sitting here. We're not going to be sitting down.
You're not going to sit on the stage?
No, because, I mean, I'll do the introduction and she'll just come out.
Oh, okay.
Did you want to sit down?
She sat down last week.
Sure, I guess I can sit down. It's just a Q&A today.
Oh, it's just a Q&A today? Okay. Do you want to sit for it, or do you?
Yeah. Because I have my notes too.
Okay. All right, let's put that up. Thank you. That's good. Okay. All right.
So, yeah, that's fine. I wasn't yelling. I'm sorry.
I was waiting on you.
I'm sorry.
Direction?
Mike, you
Huh?
sound check?
Check the, battery. No, the, feedback. The computer, testing 1, 2, and go outside. Testing 1, 2. Testing 1, 2. Testing 1, 2. Testing 1, 2. You gonna bring that down there? No, I'll bring it when we get ready. Hey, Spider. Hey, Ray. We're ready, Latrice. Testing 1, 2. Not yet. Well, praise the Lord. Good evening. I'm Pastor Chris Sorrell with Transforming Life Church. This is Learning to Do Well broadcast and our Wednesday night service. Come on, give the Lord a hand of praise tonight. Hallelujah. It's good to be here. And those of you who are viewing by Facebook and YouTube, you're welcome to come on out for this session. Our mantra here at Transforming Life Church is to love, equip, and to impact. And that's not just from a spiritual standpoint, but it's from a whole life. The scripture says that God will provide everything for us pertaining to life and godliness. And so we're grateful tonight to have with us again Latrice Jeter from Simplified Insurance Solutions. Amen. I was rushing to get here, so I apologize. She was with us last week, and so put out a lot of great information. And so, as I mentioned, so we don't just try to deal with religious type of subjects, but everything that pertains to life. And so we're grateful that she has taken out the time to be with us tonight. And tonight is a Q&A for the most part. And so we hope that if you don't get all your questions answered, you certainly can reach out, and we can make sure that you can connect with them. If you reach us on our Facebook page or our YouTube page, we'll make sure that you make that connection. And so we wanted to make this open to the public. And so if you're viewing and you're driving down the road or you're hearing it or whatever, you're welcome to come in. We're at 4626 Wentworth Boulevard, Indianapolis, Indiana. We're on the southeast side of town in an area called Kristen Park. And so 4626 Wentworth Boulevard, Indy 46201. Amen. And so without further ado, I'll go ahead and let Latrice go ahead and open up, and we'll jump right in it. And I want to thank those of you that were able to come out tonight in the house. Thank you for being with us. Amen. Amen. Thank you.
So I'm Latrice here. I just introduce myself. I was at work attendance last week. I am a licensed insurance broker and the owner of Simplified Insurance Solutions. And I have several agents that work along with me. I've been in the industry over 20 years. I started out with United Healthcare a long time ago as a brokerage account manager and then a regional marketing manager. And then I left there and moved on to Health Plan One as the Director of Business Development turned VP of Business Development. And I stayed with that company from its inception in 2006 until I resigned in 2016. And then I started my own agency, Simplified Insurance Solutions. I wanted to come home, get back in the community. I was on the road all over the country with that company. So it was nice to just come back here local and be able to
Take the mic up. Okay. Sorry.
Thank you. Microphone. Can you hear me now? Okay. So it was nice to just come back home and get back local in the community and help out. And so we do a lot of advocacy work and educate people. Our services are never a charge, even if it's a one-on-one appointment that's scheduled or you just want an educational presentation or anything done like that. There's never any fees or services to work with a licensed insurance agent or broker. So today we went over an entire presentation last week of just Medicare 101 and covered parts A, B, C, and D. We also covered what a Medicare supplement plan is versus a Medicare Advantage plan. They're two different types of coverage to go alongside with your original Medicare. And so today we were just going to do a deep dive and kind of, they've prepared some questions for me. And if anyone else has any questions, let us know. For those who are, I guess, on Zoom, if you have a question, you can just type that into the chat box. And they should be able to see those questions, and hopefully we can include those as well. Okay.
Wonderful. Okay, well, we'll dive right into it then as far as Q&A is concerned. So, and you can take your liberty to respond. So the first question is, what is not covered by Medicare Part D plans?
For the prescription, Part D is prescription drug plans. And I guess I'll start with just kind of a quick overview of A, B, C, D for anyone that wasn't, present last week. Part A of original Medicare is hospital coverage. And so that covers inpatient, skilled nursing facilities, hospice care, things like that. Part B, as in boy, of original Medicare is going to be outpatient services. So that's everything outside of the hospital, such as lab and x-ray, preventive care, emergency room visits, any type of ambulatory care, doctor visits, mental health services, durable medical equipment. Those are examples of things that are outpatient and fall under Part B. Part C of Original Medicare is a Medicare Advantage plan, and so that's a type of insurance plan that you can get through a private insurer that goes alongside your Medicare for coverage and offers at least what Original Medicare Part A and B offer. They also include additional coverage such as prescription drugs, dental, vision, hearing, and so forth, transportation benefits, things like that. And then Part D is the prescription drug plan. So those are standalone prescription drug plans would be Part D. Things that Part D does not cover would include cosmetics. I often get asked, do they cover, what do they call them? Weight loss prescriptions is a common question right now. Ozempic, everyone is talking about Ozempic, and it is actually a medication as prescribed for diabetics. The off-label use now of Ozempic would be weight loss. So no, that would not be covered because it would not be deemed medically necessary. It might be medically necessary for someone to take Ozempic for diabetes, and so that would be covered. But if it's not deemed as medically necessary, it's generally not covered. So anything that's like cosmetic purposes, weight loss in certain situations might be covered. The majority of weight loss medications, however, would not be. The other thing, when you have a Medicare Advantage plan that includes prescription drug plans or does not, or if you have a standalone, prescription drug plan, which is just a Part D plan by itself, they have what's called formularies, and that applies to every single plan available. And so with a formulary, it's just a medical way of saying, here's the drugs that we cover. And so every single plan available for prescription drug coverage under Medicare has its very own formulary. An example is, say that you have a Humana plan or United Healthcare plan, and your neighbor happens to have the same carrier but a different plan than you. That means you probably have two different formulary lists that you're operating under, even though it's with the same carrier. And so anything that is not on formulary, they generally don't cover. There are exceptions to that, however. A doctor can request it, which is a prior authorization that they cover the drug, and then it would be covered. There's an appeal process that's available to those that have Medicare prescription drug plans, where the doctor goes through what we call step therapy, and they say, try this drug. Oh, that one didn't work. They tried another drug that might be on formulary. That one didn't work. And then they say, okay, well, we must approve then this drug that is off formulary. So that's called step therapy. So there are ways to get a drug covered that is not on their formulary, but it must be medically necessary approved, and approved, of course, by the doctor and the insurance company. And so that's how that works. But in general, all of the plans as well, with each formulary, they have to cover under every single formulary list at least two of the prescriptions within every single category of prescription that there is. So what I mean by that is, say that you take a certain asthma inhaler and your prescription drug plan doesn't cover it. Whatever prescription drug plan you do have, it means they have to have an equivocal prescription available of that exact same inhaler on their formulary list as well. So there are exceptions made often when people will call me and say, hey, Latrice, I've been taking this prescription for 7 years. I just, the formulary changed this year and now it's all of a sudden not covering it. That doesn't necessarily mean I need to switch their plan out. It means I need to explain to them what I've just explained to you. Most often they can go ahead and get their prescription covered and get an exception made. And that's not some lengthy process that takes, months and months and months to get done. It happens pretty quickly as well. So if you do have prescriptions that aren't covered, you want to either reach out to your carrier or reach out to your doctor and work alongside them to get that figured out for you, versus just depending on the pharmacist will usually just tell you it's not covered. So you want to circle back to your doctor or circle back to your insurance provider, and they should be able to make sure that you're going to have the prescription coverage you need.
wonderful. I just want to also put this out there. If perhaps you missed last week's broadcast, you can go back to our Facebook page and see the broadcast as well, where you can see the total presentation. So thank you for giving us a quick review over the different types of plans. But if you missed it, you can go back last Wednesday, and you'll be able to see the program as well as tonight. If you missed something, you can go back as well. Okay, so how do I pay for my Medicare parts, A, B, C through D? How do I pay for those?
Yeah, so Part A and B, once you enroll in Part A and B, the most common way to pay for that is either through your Social Security check. They just pull the Part B premium right out of that. Remember, Part A for the majority of Americans is a zero premium. Part B for the majority of Americans this year in 2024 is $174.70 a month. That does increase a little year over year. If you have a higher income category, we covered last week, then you pay a little more than the average American. So for Part A and Part B, they would just pull that right out of a Social Security check or a railroad retirement benefit check. Those are the only two ways that they'll just auto draft. Other than that, you can just have a bill sent to you each month in the mail and pay it that way. For Part D, that is prescription drug coverage, a standalone plan. That's always through a private insurance carrier. Just like with any insurance, you have multiple options. You can have it set up to come straight out of your banking, checking or savings account each month. You can choose to receive a bill at home and pay that way as well. So those are the options. And then for Part C, which is a Medicare Advantage plan, same thing. It's through a private insurer. So they'll either pull it automatically out of a checking account, savings account. You can have a monthly statement sent to you. And with all those options, Part A, B, C, and D, you can also choose to have the entire payment for all of them taken out of your Social Security or railroad retirement benefit check monthly as well. One thing to note when you first sign up for Medicare, they're usually a little behind, I've heard. And so you might enroll in Part A and B, and your coverage effective date is, let's say, July 1st. And then August 1st rolls around and you say, I didn't get billed in July and August. Lucky me, nothing came out of my Social Security check. They can take up to 3 months on average to start pulling those funds out. So be aware for new enrollees, or if you're switching out plans or something like that, it can sometimes take up to 3 months to see those payments come out of your check. And so when they do finally pull it out, in my example, they would be pulling out July and August and September if that's the first month that they start to take the money out. So you would see 3 months worth of payments, 2 months, or 1 month come out. So that's just a common question I get as well about the payments for Medicare.
Awesome. Next question, what preventive services does Medicare cover, and is there a cost?
Preventive services for original Medicare Part B fall under Part B, The cost for Part B this year in 2024 is a one-time annual deductible of $240, meaning the minute you go to utilize your Part B services, if that's all you have is original Medicare A and B, they're going to immediately bill you $240 for those outpatient services. So that includes preventive care. After the $240 one-time annual deductible this year, Medicare then begins to pay 80%. You're billed 20%. And that's all outpatient services to include preventive services. So that's what you could expect to be billed, would be the 20% after you've met your annual $240 Part B deductible. If you have a Medicare Advantage plan, it depends on what plan you have. Most often, preventive services under those plans are going to be covered with a zero copay. Remember, Medicare Advantage is original Medicare Part C, and they pay instead of original Medicare. They must cover at least what original Medicare covers or more. all of them cover more than original Medicare. That's why people enroll in them. So you usually just have a zero copay for preventive services under a Medicare Advantage plan and primary care visits on the bulk of the plans out there. What else can I say about preventive? You asked, what does it cover? Specifically, let me look at my notes here. For preventive services, it'll cover exams, screenings, shots and immunizations, any laboratory tests, counseling. There's some other services that threw in there too, such as health monitoring programs and medical nutrition therapy. Some services, of course, though, there's always exceptions to anything that I say. With preventive services, some services are only covered for people who meet certain criteria. So it might be based on an age range or certain risk factors. An example of that would be mammographies are going to be covered once a woman reaches age 40 and over, because that's just medically when they deem those as medically necessary as preventative care. Glaucoma test is another example. It would cover a glaucoma test if you're considered high risk for glaucoma at a certain age or point, based on what a medical diagnosis or what a doctor has to say about it. So there are exceptions of when certain services would be covered or why. Preventive services as well do not cover things under original Medicare A and B, such as dental, vision, hearing, eye exams, those types of screenings. The exams for eyeglasses, cosmetics. It won't cover things like massage therapy, chiropractic therapy. However, Medicare Advantage plans, the majority of those do. And so those, again, are the zero premium plans, Part C. So where Medicare preventative services leave off, the Medicare Advantage plans usually pick up and add that coverage to it. So Medicare Advantage plans will cover dental and vision and hearing and screening exams. Many of them will cover chiropractic care, limited but covered, as well as things like therapy and massage therapy and things like that.
Great, thank you. Does Medicare cover reprise care service?
Respite care?
Is that
Respite?
I'm sorry.
Yeah, it's okay.
Got my glasses on.
Yeah, respite and hospice care. Yes, original Medicare does cover respite care. Let me think for a second. For respite care, that will fall under Part A of original Medicare, and it generally covers, I believe, up to 5 days of respite care. So it's quite limited what it does cover.
What is that? What kind of care is that?
Respite care is basically you're very, very ill, and so you have to have a caregiver. A lot of people for respite care as well. It can also be the person taking care of someone. And then hospice care is end-of-life care when I refer to that. So it'll cover up to about 5 days. The Medicare Advantage plans cover respite and hospice care as well. It's just more coverage. It's not as limited. And it depends on which plan you enroll in, specifically how much coverage you would have available. They'll offer also cover with the Medicare Advantage plans. Home health care is very common now. A lot of people want to do their respite care, hospice care, and just their even hospital and medical care at home. And so the Medicare Advantage plans, many of them will cover that at no charge for home health care as well.
Thank you for that. I think you may have already covered it, but I wanted to ask it again. What out-of-pocket costs Medicare pays for drugs?
For prescription drugs, so the prescription drugs are changing again for 2025, and I'll just quickly review 2024. This year, for prescription drugs, there were 4 different coverage levels under original Medicare Part D, And so you had a deductible phase, or I should say 4 different phases of coverage. You have a deductible phase as phase 1. And of course, it depends on what prescription drug plan you have, how much your deductible is going to be. And then after that, you have phase 2, which is called the initial coverage period. If you have a Medicare Advantage plan or a prescription drug plan, this is when your copays kick in. So you're paying 0 or a small copay, depending on what level or tier your prescription falls on. That determines the cost that you would pay, or cost share. But you're paying a small copay to go fill your prescriptions during that phase. And then there is a phase 3, which was called the donut hole, is the most common name. It's actually the coverage gap for prescription drugs. During that phase this year, you're paying 25% of prescription costs out of pocket. That's usually when people see their prescription costs go up a little bit, because they're out of that second copay phase. Now they're paying 25% of whatever that prescription costs. And then the 4th and final phase, and I should back up, to go from the initial coverage phase and fall into the donut hole, or that coverage gap period, you would have reached $5,030 in out-of-pocket costs for your prescriptions this year. And that's combined, of course, you're paying a small portion, but the insurer is paying some of that as well. And then you have manufacturer discounts behind the scenes as well, going towards those costs a lot of people aren't aware of, but it happens often on costly prescriptions that they'll just throw a discount in there that you just don't even know about. So you have your phase 1 is deductible. Phase 2, you're paying copays up until the total cost for your prescriptions in the year reach $5,030 this year. That moves you into phase 3 in 2024, which is the coverage gap or donut hole. You're paying 25% of the cost of your prescriptions. And then once you reached $8,000 this year, then you would go into what's called the catastrophic phase. And you used to pay a portion of cost even in the catastrophic phase. They've done away with that this year, and so it's just covered 100%. Once you get into the catastrophic phase, you're done paying out of pocket. You're covered 100% the remainder of the year. What I just stated is true of all prescription drug plans under Medicare. So whether it's under a Medicare Advantage plan with prescription drugs, or it's just a standalone Part D prescription drug plan, those are the 4 phases, and those are the major costs involved. For 2025, we have the Inflation Reduction Act that was passed, and so that goes into effect under 2025. It's very simple now. There's not the 4 phases anymore. They've done away with the coverage gap or the donut hole where everyone's costs used to shoot up. Not everyone, many people's costs would shoot up. So now for 2025, you have the deductible phase is phase 1, and then you go into phase 2, where you're paying 25% of the cost, or if you have, a prescription drug plan, Medicare Advantage plan, you're paying some type of copay amount under your plan. And then once you reach $2,000 in prescription costs for the year, you move into the final catastrophic phase after $2,000 of cost, and then you're covered 100% the rest of the year. So what that's going to do for 2025 is cap your out-of-pocket cost at $2,000 in prescriptions for the year. Under CMS, the Centers for Medicare and Medicaid Services, they rolled out a final ruling that all carriers who offer Medicare prescription drug plan coverage must as well offer a monthly payment plan. We're going to see a big difference in the prescription cost here in 2025 now with that new ruling. And so many clients might say, oh my goodness, I don't want to pay all of this out of pocket, up to $2,000 and then be covered 100%. But what'll happen is that they'll have that monthly payment plan available. And so whatever prescription drug plan you have, whether you read the mail that they send you or not, because I know many of us get so much mail from all those carriers, you just start tossing stuff. They'll send you something in writing. They'll update you on what to expect, and they'll also notify you that you can enroll into that monthly payment plan. There are no qualifications to enroll other than you have a prescription drug plan. So everyone qualifies for it. Some of the carriers, I've been notified, will auto-enroll some of their members. So if they can see on their side you're already a current member and they're tracking and seeing how much your prescription costs are this year, and they think they're kind of high, they're just going to automatically enroll you in that monthly payment plan for next year. If you are automatically enrolled, you have the right to opt out of that monthly payment plan if you don't want to remain enrolled in it. Otherwise, if they don't enroll you and you want to get enrolled, you can get enrolled. How the monthly payments are going to work is they're basically just taking your prescription cost and spreading it out over the year for you. So where you have to pay out of pocket up until that $2,000, you don't want to probably be paying that in 3 months out of the year. They're just going to spread your cost out depending upon what your specific prescription costs are, so that it just spreads out over the 12-month period. So don't let that confuse you. You're still only paying up to the maximum $2,000, and then you're covered 100% the rest of the year. However, if you see you're getting prescription costs all year long, then that should tell you you're most likely on a monthly payment plan. And that's why, because they're just spreading that cost out for you so that you're not having to pay that $2,000 amount, within just a few months of the year.
Great. Does Medicare coverage change if a person returns to work?
No, not at all. You can have both Medicare and employer group coverage. You can have Medicare and veteran coverage. So with employer group coverage, what happens is called a coordination of benefits. So let's say that I'm working for an insurance company, and I've also aged into Medicare, and I enrolled in my Medicare Part A and B, and even enrolled in a Medicare Advantage plan or a Medicare supplement plan along with it. And then I decide, a year later, I'm bored, I'm going back to work. Well, typically your employer is going to offer coverage as well. And so you have the option to either opt out of that employer coverage, and you got, great Medicare coverage already. Or if there's something that you do like about the employer coverage, you can go ahead and still enroll. It will not affect your Medicare coverage at all. And then you just have both. You have Medicare and employer coverage. You're probably overinsured at that point, but you still have both. And how the coordination of benefits would work is that Medicare would pay secondary to the employer coverage. So anytime you go to the doctor, you want to then show your employer's insurance card as well as your Medicare, whether it's a Medicare supplement or Medicare Advantage. You want to show that card as well. They're going to bill the employer for the claims process first, and then whatever out-of-pocket costs were left over, they're then going to bill your Medicare insurer, and they'll pay their portion of the remaining balances. My suggestion is that if someone already has Medicare and they already have a Medicare supplement or a Medicare Advantage plan and they go back to work, would be, unless you're a government employee, because their coverage is phenomenal, totally different ballgame of coverage, or you're a veteran with TRICARE, which just pays everything 100%, then it usually doesn't make a lot of sense to pay for that group or employer coverage unless you have a family member or something like that, a spouse or some children that you're wanting to cover. But in general, you're just over-insuring yourself to have both.
Thank you. How does the Inflation Reduction Act impact Medicare services?
Yeah, so I already really went over that. It's the prescription drug plans. So again, we're going to go to a deductible, and then you go to up to $2,000 maximum out of pocket for 2025, and then 100% coverage on your prescription drugs the remainder of the year for 2025. That was from the Inflation Reduction Act. Yep.
Wonderful. I think you covered this, but I'm going to go ahead and say it anyway, or ask anyway. why should I care about my mid-year statement from the Medicare Advantage plan?
You said a mid-year statement. I'm thinking you might be referring to the annual notice of change, maybe, with mid-year statement. So those come out in September. They have to have them out under CMS, the Centers for Medicare and Medicaid Service Rules, by the end of September. If you have a Medicare Advantage plan or a prescription drug plan with your original Medicare, the carriers are required to send you what's called an annual notice of change summary, an ANOC, once a year. And what that outlines for you, and they usually just put them side by side, page by page by page, is here's your specific plan that you are enrolled in currently. Here's your benefits for this year versus here are the benefits for next year. And so they go item by item. It's itemized by everything that you have coverage for to show you any change. It shows you any changes that you can expect for the next year. So those are very important that you review those. Now, a lot of clients don't. They just toss them because they get so much Medicare mail. Understandably, it's just like, I don't want to read through this. Again, we're there for that too as agents and brokers. We keep up on our clients' needs, their changes. So you can always feel free to reach out to your insurance agent or insurance broker and say, I have no idea what changes are coming for 2025. I didn't read the letter. Can you go through it with me? And we're always more than happy to pull up the plan and point out any differences that might affect you, with the way that you're utilizing your coverage. Another thing I'll say about, just as a reminder, when you get those annual change notices, is you want to always check for doctors and hospitals. Doctors and hospitals pull in and out of networks. They're under contracts for, which networks they want to be in. And so if a contract comes up, a doctor may decide not to renew the contract with that carrier, meaning they're no longer in that network. So that's when they notify you of things like that too. So you want to keep an eye out to make sure, most importantly, that all of your prescription drugs are still covered on the formulary each year, and all of your doctors that you have in network will still be in network. If you see any other changes or changes like that that are going to negatively impact you with your coverage for the upcoming year, you just want to reach out to your agent or your broker, and we, go over your needs and budget with you again and make a suggestion to switch your plan out. If you have no worries and you love your coverage and nothing's going on and nothing's really changed, you can always just keep your plan. They just re-enroll you year after year after year without you, having to do anything. No different than your homeowners and auto coverage. As long as you keep paying for it, you still have the coverage. But if you do have major changes come up throughout the year, such as new prescriptions you're taking, or you think your costs are getting too high, or like I said, certain doctors aren't in network or things like that, or you're just not content with the current plan that you have, again, you just always want to reach out so that we can do a plan review with you, we call it, and make suggestions to switch you out to a different carrier or a different plan under the carrier that you currently have. One other thing that makes me think of, a lot of people aren't aware of, the carriers are always rolling out new insurance plans year over year over year. And so I mentioned last week, and I'll mention it again, when you look at the benefits on a plan, even if it's a zero premium plan or a plan that has a monthly premium, remember they're looking at per zip code for this particular plan, how many premium dollars are we bringing in versus how many claims are we paying out actuarially each year. And so if you see that your plan loses quite a few benefits that you liked, or say you have a Medicare supplement and you see that your rate all of a sudden went up 30–40%, that's a reason to call your insurance agent or broker and say, hey, my rate just went up and I'm not happy with it. Or, hey, they just cut out these 3 benefits that I used to have and I really liked having those benefits. More often than not, there's some other plan, even with the same carrier that they've rolled out, that you're just not aware of, that we can switch you out to where you can have those benefits again.
Awesome. That's really good to know. One of the last questions I have, and then we'll open, see if there's anyone in the audience that has any questions. What are special need plans, and how does a person qualify for that type of plan?
Yeah, so there's two types of special needs plans. That's a good question. One of them is for dual special needs, and to qualify for a dual special needs plan, that means that you have both Medicare through the federal government, A and B, as well as Medicaid through the state. The way you qualify for Medicaid through the state is always either based on income and or, not either or, income and or disability. So, and if you do qualify based on a disability and you receive SSDI, Social Security Disability Income, after 2 years of receiving Social Security Disability Income, you then automatically qualify for Medicare Part A and B as well. So a lot of clients we've talked to that have Medicaid and are receiving SSDI, they're just not aware. And they'll tell me, I've been receiving disability income for the last 8 years. I didn't know I qualified for Medicare because I'm not 65. So don't forget the 2 ways to qualify for Medicare is one of them is you age in by turning 65. The second way is what I just said. You have 2 years of receiving Social Security Disability Income that automatically qualifies you for Medicare Part A and B after a 2-year wait. The third and only reason is you have either end-stage renal disease or Lou Gehrig's disease. So with that said, with Medicaid, which is through the state, you qualify for that based on either low income and or disability. And if you have both Medicare Part A and B as well as Medicaid, regardless of the level, because there's several different levels of Medicaid. It used to be just as recent as a couple of years ago, there were only 4 levels of Medicaid that would qualify you for a dual special needs plan. And that was qualified Medicare beneficiary plus, qualified Medicare beneficiary, Slim B plus, or FBDE, which is full benefit dual eligible. And then there's 3 other levels. Well, now, starting with this year in 2024, and we'll follow suit next year as well, all 7 levels of Medicaid will qualify you for a dual special needs plan, as long as you have Medicaid and Medicare combined. A dual special needs plan has a ton of extra benefits. So you qualify, let's say, for example, a standard Medicare Advantage plan has an over-the-counter out-of-pocket allowance of $75, maybe every month or every 3 months. A dual special needs plan from that same carrier might give you an over-the-counter allowance of $200 or $300 per month. So it's a very big difference in the amount of benefits that you get if you have, if you're dual special needs. Usually with the extra benefits, we see a lot more coverage. Most that qualify for dual special needs plans, most of your out-of-pocket costs go to 0 or very, very low, because Medicare is paying first, and then Medicaid is stepping in, paying what would be some out-of-pocket costs for you. It depends on what level you are with Medicaid, of course, but it does make most of your costs go to 0 or very low out-of-pocket costs by having a dual special needs plan. The other type of special needs plan is called a C-SNP. That's a chronic special needs plan. So in Indiana, for example, we have chronic special needs plans for those that have like heart conditions, or those that have diabetes, for example. And those plans are basically geared around when they're creating the formulary list for those plans, when they're putting together the network for those plans. Of course, they're gonna, if it's a heart chronic special needs plan, they're gonna make sure that they got a ton of heart doctors, and specialists and surgeons and so forth available in the network. Same thing with the formulary. They're gonna really beef up on that formulary the most common prescriptions for those that have heart diseases and so forth. So that's what a chronic special needs plan does, is kind of focus cautious on. And things like certain durable medical equipment, make sure that the costs are really low, and things like that. For you, you have specific conditions, it can qualify you for a chronic special needs plan. And then Medicare and Medicaid combined qualify you for a dual special needs plan.
Great, great. I'm going to open it up if there are any questions that anyone will have. Well, come on up. We want to make sure we get you. Yeah, we want to get you on your good side. Go ahead.
Oh, I have a question. I have Humana, like I said, talked to you before. I have Humana, was it a supplement plan?
Medicare Advantage.
Medicare Advantage. Okay. Okay, it takes, well, before I started, they were taking $174.70, right? Now, with Humana Advantage, will only take $74.70. Is they going to reimburse me that?
So you have original Medicare A and B.
Right.
Your Part B premium monthly is $174.70.
That's what it started.
The Humana Medicare Advantage plan, and now they only take out $74.70
Correct.
for
Correct.
your Part B.
Correct.
So that tells me you have the Humana USAA plan.
Yes.
It's for veterans.
Right.
You must be a veteran.
Right.
So you're getting a $100 give back. So you do still owe $174.70 a month for your Part B coverage.
Mhm.
However, the type of Humana Medicare Advantage plan that you have for
Mhm.
veterans,
Mhm.
they're giving you back $100 by not taking it out.
But where is it going to? I don't get it on my check.
No, they're just saving you money.
Oh,
You can look at it more of a savings.
okay.
Yeah, because let's say this, if you were to cancel, annual election period starts next week.
Right.
October 15th.
Right.
You drop that Humana plan during October through December.
Uh-huh.
You drop that Humana plan and you go to open that Social Security check again.
Well, they're gonna take that. Of course.
You see what I'm saying?
Yes.
That's why they call it Part B give back.
Okay.
So they're basically just saving you $100 a month or $1,200 a year.
Uh-huh.
Just from having that Humana plan that you enrolled in. It's a zero premium plan.
Correct.
You have all those extra benefits. Now you can use the VA, or you can go and see Humana network doctors and
Right.
hospitals.
Right.
You can see any emergency room throughout the country. Humana's network is countrywide too if you travel and so forth.
Correct.
It just gives you a bunch of extra benefits that you didn't have that is no extra charge to you.
Mhm.
It's saving you $100 a month.
Okay. I just didn't know where it
Don't
went.
cancel it.
No. No.
It's a good plan. Know exactly what you do. I didn't mention today, I mentioned this last week, I guess I should mention today for if there's anyone on the Zoom that wasn't present last week. I am a broker, and that just means I offer all of the carriers in the state. So I represent United Healthcare, Humana, Anthem, Aetna, Cigna, Mutual of Omaha. That's a long list. It goes and goes. Zing, Devoted. There's a lot of carriers out here. And I represent them for Medicare, health, individuals under 65, the federal marketplace, as well as I'm a life insurance agent and represent several carriers on that side as well. So that's how I know exactly what plan. I know these plans in my sleep.
Hi, I'm Destria. My question is, because I'm 100% disabled, according to Uncle Sam, I have Part A and B, and I guess I had a D Part 2, but because I have Humana. I got a card for TRICARE for Life. Am I enrolled in TRICARE for Life, or do I need to enroll in TRICARE for Life? Or is that just like having Humana? Because I do everything at the VA.
You have TRICARE for Life. You don't get any other insurance coverage. If you were to enroll in a Medicare Advantage or Medicare Supplement plan, it could cause problems with your TRICARE for Life. So that's an exception there. If you have TRICARE for Life, you're covered 100%.
No, what I'm saying is, I have Humana, but I'm not sure that I'm enrolled in TRICARE for Life. Because wouldn't I be paying for TRICARE for Life?
No, not if you qualify for it. It would be based on either your or your spouse's military service and what level they were as an active duty.
I got more than him. I was an officer. So I was an officer and 100% disabled, according to, so.
Yeah, I would suggest you might want to reach out to the VA and find out if you have TRICARE coverage. You have a Humana prescription drug plan only?
Yes. Yes.
Just a standalone PDP plan?
Mm-hmm.
Right, okay. Because most of us as agents will not enroll a TRICARE member into a complete Medicare Advantage plan.
Okay.
Because it could interfere with your TRICARE benefits.
Okay. All right. I'll check that out. Thank you.
Yeah, you're welcome. Once you find out if you have TRICARE, also you can always give me a call direct. And then if you do have TRICARE, I'm just going to tell you don't get anything else like that you don't already have other than your PDP. If you don't have TRICARE for life, then it might suit you to enroll in a Medicare Advantage plan just to get even more benefits. But if you do have TRICARE for life, you don't need a Medicare Advantage plan.
Okay. All right. Thank you.
You're welcome.
Now, that's my wife. Now, how would that also affect me? How would that affect me?
Do you have TRICARE for life?
I'm under her.
I doubt that you have TRICARE. Maybe you all don't have TRICARE for life then.
Cause she retired. She higher ranked than me, so was her dependent.
Yeah. See, TRICARE for life is completely separate. There is no coordination of benefits, by the way. Like how I said with employer coverage and Medicare, there's a coordination of benefit. There isn't one between the VA and Medicare. So they're just two completely separate things.
Two different entities.
Yeah. So it's not like when you submit a claim, it's going through one and then automatically going through the other one. So you're either choosing to stick with the VA and use those doctors and hospitals and their pharmacy, which is just your VA coverage, or you're choosing for you to use your Humana Veteran Medicare Advantage plan. But there would never be a time when you go to a doctor and they're billing one and then the other secondary. The same thing is true for TRICARE recipients. However, there is a good reason why. And I should say with TRICARE, there's a couple different levels of TRICARE too. Most people I talk to, they're on a TRICARE level where it's not in their best interest for me to enroll them. I don't think I have my TRICARE notes with me today. Yeah, I would be able to, I want to look into that for the two of you and for her, and then I'll just follow up with you and let you know what I would recommend. Because there are levels of TRICARE where if you enroll someone in a Medicare Advantage plan or a Med Sub while they have that level of TRICARE, they lose some of those TRICARE benefits. And we would never want to have that happen.
Right.
So yeah, I would say for you all to find out, see, do you actually have TRICARE first? And then
How will we, talking about call that 1-800 number and see if we,
yeah, if you have a card or a letter or anything that even mentions TRICARE, then you want to, it should have a contact number on it, and you can easily find out, or from the Veteran Services if you have TRICARE for life.
okay. All right, thank you.
You're welcome.
Okay.
Okay.
Thank you. Are there any other questions? Are there any other questions this evening? Well, all right, well, come on, let's give the Lord a hand of praise. Thank you, Father. If you mind, sake of someone coming back and reviewing the broadcast, you would give your name, your agency, and your contact information, where how they can get in contact with you if they want to.
Yeah, thank you. So my name again is Latrice Jeter. My agency is Simplified Insurance Solutions, LLC. Our offices are located over at Fort Benjamin Harris. We're right there in the same building as Giacomo's Pizza and across the street from Panera and the Social Security Department. And I'm right in front of the YMCA. So very nice spot for me to have an insurance agency. We're at 9165 Otis Avenue, Suite 210. And my contact number, my cell phone number is 317-213-1091. You can reach me by email. That's ljeter@simplifiedinsurancesolution.com. And then we have a website as well, and that's simplifiedinsurancesolution.com. So we welcome any questions. Again, our services are no charge to you. And if you know of anyone you think we could be of help to, please share my information with them as well.
Wonderful. Thank you. Thank you. And we certainly thank you for being here with us, helping us. This is our October has been deemed Family Month in the month of October. And so it's important for us to be able to bring this type of information to not just Transform a Life Church and partners and friends, but to the community at large. And so we are grateful that you took the time to come out. And,
Thank you for having me.
Yes, absolutely. And hope that your office get flooded with calls. So thank you so much. Our next segment, pardon me, is not next week, which is the 16th, but the 23rd of October, which we start talking about veterans and veterans benefits. Indiana is one of the really veteran-friendly states, and so there's a whole lot of programs and different liberties that veterans have in this state that perhaps others or most veterans don't know about. So on the 23rd, here at 7 p.m., we have representatives here to talk about that and to help us get the word out. So we're excited about that. So again, thank you, Latrice, for being with us. And thank you all for being with us tonight. Those of you on Facebook and YouTube, as I mentioned, if you missed last week's broadcast, you can go back, which was the 2nd of October, and see that broadcast. And of course, tonight you'll be able to see it as well via YouTube or Facebook. Other than that, I want to invite you to come out and be with us here at Transform a Life Church. We're located at 4626 Wentworth Boulevard, Indy 46201. We are on the southeast side of town in an area called Kristen Park, just a few minutes from downtown. So if you don't have a place to worship, we invite you to be our special guest. We start at 10:30 sharp on Sunday mornings, and we would love to have you to be our guest. So thank you for being with us tonight, and we hope to see you. We hope to see you soon. Thank you so much.
Thank you.
I'll be in touch, dude.